make sure your platelet count, your INR, everything is normal before we do that.
So we're looking at Monday for that?
Yeah, I think we might be looking for that. I'll order it, but I don't know if anybody wants to do it on the weekend.
Yeah. Only for Aggies.
I'll let you watch the game.
I'll watch the game and
Yeah. Okay, so that would happen on Monday. If
I-
were to happen on
Well,
Monday.
if somebody wants, if one of the interventional guy wants to do it tomorrow, it's fine with him. Well, I want to make sure our INR and platelets are okay tomorrow morning.
Okay. So if that were, how long would it take to get the sample back from the biopsy?
Oh, the sample, so nobody will read it on the weekend. So they will read it on Monday only.
Right,
So
okay.
they're not only reading, they need to prep it. They need to prep the tissue.
So Monday's the earliest you know anything, no matter what happens this
No,
weekend.
Monday you won't know anything. You know, on Tuesday.
Tuesday, and that's
Yeah.
after they...
So
okay.
what do they do is they section the tissue multiple times, and then they fix it in a preservative, and then the pathologist is going to see it.
Okay. So
it'll
Tuesday
take-
the earliest for that.
Yeah.
And that's if that comes back normal, you don't have to do the pancreas?
Yeah, probably not. If that back comes
If that
back,
comes
no,
back-
no, if that comes back normal, then we might have to go to the pancreas.
Pancreas to make sure it's normal. If it's not normal, if it's cancerous or something happens.
You don't have to. Then you don't have to look at the pancreas lesion. That's what the oncologist was doing.
Gotcha. We know we have trouble here, so we just...
Most likely, because she just had a colonoscopy by Dr. Zabagi. No, I don't think you had a tumor there. So a lot of times the lesions in the liver are from the colon or from the pancreas. These are the main two areas. So you said the colon is clean, and we found out that there is a small lesion in the pancreas. And if this lesion is completely normal or it doesn't correlate with what we think, then we might go to the pancreas.
And then you just got to figure out how to get there.
Yeah, there are two ways to get it. By endoscopy, we can get it. By endoscopy, it's a special scope, but it's a very thick scope. We go through the mouth. It's not the scope I use. It's double the size. But so we go into the stomach and we scan from inside. Actually, we do an ultrasound from inside and look at that area and pass a needle through the stomach wall.
Okay. To grab some of that.
Some of
And
it.
bring it back in. Okay. Okay.
What was that M word you said? Something disease?
What is that?
You
For what?
For the disease being in both the pancreas and the liver,
Oh, that's a neuro. Yeah, it's neuroendocrine lesion. Neuroendocrine. So it could be insulinoma, or it could be gastrinoma, or it could be. So those lesions are different from actual pancreatic cancer. So in pancreas there are different cells. One is some cells produce insulin, some cells produce glucagon, some cells produce amylase and lipase, the enzymes needed for pancreas. So tumors can arise from different kinds of cells.
Okay. And the tumor she has, because it's vascular, makes
It's
you...
vascular. Mostly we think that it is
Not-
neuroendocrine, not
Okay.
cancer.
So a non-cancerous, benign type of
Yeah,
tumor. Okay.
not benign.
Well,
It is a tumor,
okay.
but it responds differently to chemotherapy
So chemotherapy would be the treatment
for that too.
Okay.
If it's pancreatic tumor cancer, then she probably needs surgery
pop it out.
to remove it. But if this lesion is adenocarcinoma, then whatever the oncologist says, then we have to treat that way. I mean, so whether he wants chemotherapy or anything like that. So if it's a neuroendocrine, it's probably just chemotherapy, no surgery or anything.
I just, and this is probably unrealistic, but I just really want to know by the weekend. It doesn't sound like there's a way to know
No,
that.
well, we won't know. We won't know by the weekend. They might do a biopsy maybe tomorrow or day after, but not.
This process.
I mean, the pathologists, they only see the slides. They don't see the human being.
So they're here Monday through Friday.
Yeah.
Okay.
And
So,
yeah.
well, make sure I get this right then. So what she has something on her pancreas.
Yeah.
Don't know what it is.
No.
But you're fairly confident it's of a cancerous nature.
Yeah, I think so. The way the tumor looks like, I mean, say it's vascular. It's not a cyst. Definitely, I can say cyst is fluid-filled cavity. It's not a cyst.
So
It's a mass.
There's a mass there.
The mass in that area in that area is mostly other than a carcinoma. It could be neuroendocrine tumor or something different, but usually it's rare to have an adenocarcinoma or a pancreatic cancer in that area. Usually it's in the head.
So it's rare for her to have it where it's at?
No, in that area. So pancreas has different regions. So there's the head, body, and the tail. And the tail areas are most common. Sometimes we see this neuroendocrine tumors.
And that's what you think she has?
That's what I think he has, but I cannot say until we get the tissue diagnosis.
Okay. And there's a difference between that and cancer?
Yeah, there's a difference between that and because the cells are different.
Okay.
In pancreatic cancer, the cells are different, whereas in a neuroendocrine tumor, the cells are different. This tumor arises from the cells producing the hormones.
Okay. So the treatment's different and the prognosis is different?
Oh, prognosis is completely different, but I can't tell you because I'm not an oncologist.
Gotcha.
I don't know also much what's the
Well,
prognosis.
the little-
What kind of therapy they use. Whether they use chemotherapy or chemoradiation, or they would say just surgery.
Yeah. The little guy from Hellerstadt's office was here last night, late. It was
Oh,
like
okay.
11. And he was like, "Hi, do you remember me?" It's like, "Yeah." He goes, "We've been looking for that blood and stuff, and I hear you're doing, what was doing CAT scan or whatever." And I said, "Yeah." He was like, "Well, we're going to help you find it." Because he had sat on this chair and gone, "I can't find it. It's not here. It's not here. It's not here."
What?
The blood. He was looking for the blood.
Oh, the blood. Okay.
So I have a feeling you might hear from Hellerstadt.
Oh, okay. All right.
Okay, so we're gonna biopsy the liver to find out if it comes back clean. You still have to biopsy the
Yeah, if it's clean, then we have to buy
pancreas.
pancreas.
If that doesn't come back clean, you're treating all the way around.
Oh.
No matter what, you're treating. But that would be a form of cancer in the liver.
It's a metastatic. Metastatic.
That's what I wanted to know.
Okay. All right. So
It's
either
not.
one.
It's not primary liver. It won't be a primary liver cancer because we already looked for tumor markers in the liver. It's normal.
Okay.
Yeah.
So what's that word? The non-person.
Neuroendocrine tumor.
So that's the better of the two.
Yeah. If you choose.
If you have to have something,
I would say if it is just a cyst, it's the best thing.
right? But we didn't score that card.
I doubt it because on the CT scan or the MRI, the cyst appears very clear, but it's not like that. It looks like a mass.
That couldn't be just her jiggling, could it? Not holding her breath right?
Well, he compared with the CT.
Yeah. Okay.
So we have a CT to corroborate the findings.
Okay. So get a biopsy, and we get and somebody tells us what we're gonna do next.
Yeah, I'll be the one. Nobody else.
Okay.
So,
Nobody else wants to come in here.
He's like, "No one's working anymore.
There's too
Everyone's
many
going
damn
on
people in there all the
vacation."
time.
so
But the oncologist won't be coming in at some point.
oh yeah, he'll be coming in after the biopsy. But here, the oncologist here, I think you're seeing Kevin Donor,
That is
Yeah.
the partner of.
partner of Hellerstadt. So
He's her father.
Partner.
partner.
Partner. Oh. Whoa.
He's like a son. He's much younger.
Yeah.
Then her.
She's
No,
like 53.
Stop it.
Yeah.
She's
She's young.
Well, you've
She's
seen her.
53.
She is what?
Hellerstadt is 53.
I
Yep.
don't know.
Yep.
Hellerstadt's in her
She
30s.
is not.
Bet me.
She is not 53.
Later.
That's besides the
She
point.
was on the news other day. I saw her picture.
I did too.
Yeah, on the Austin Statesman.
She's 53. No way.
She's doing this Austin. She's like responsible for all the cancer research in Austin.
All right.
Wow.
She's supposed
I
to
knew
be
we were seeing the
brilliant.
right
I
one.
think she's very brilliant.
Yeah,
Great
that's
shoes,
what I've
too.
heard.
God, Philip.
Okay, the only other thing I have is, why does my stomach still hurt?
Well, I think probably it could be because of those lesions we see in the liver. But I told you the other day I was palpating the liver.
Yeah.
It could be from that.
Okay.
Yeah. Because I think you're getting enough morphine. I don't want you to be doped up.
No.
So what do you do for the?
Ascites?
Yeah, I mean all that stuff's like.
No, ascites is much better. This
I know
the
it's
best I have seen the other day on is the ascites has actually reduced a lot.
Yeah.
Yeah.
She's still in a lot of
I
pain this
mean,
morning.
it's better and it's mushier,
Mush.
but it hurts a
Yeah,
lot
yeah.
still, and I didn't
Still?
expect the pain.
Lay down for me. It's
I only thought you were
would say
done with the gloves.